Hi, it is good to see you again. So everything is looking great with this pregnancy. What questions do you have at this point? Oh yes, that's a great question. We can certainly talk about your birth options because you had a C-section in the past. So you can choose to go through labor and have a vaginal delivery. This is called a trial of labor after cesarean, also known as TOLAC for short. A trial of labor might work and then end in a VBAC, which is a vaginal birth after cesarean, but sometimes it doesn't work and then you may need another C-section to deliver your baby. Or you could plan to have a scheduled C-section before your labor even starts. In the past, it was thought that after a woman had one C-section, then she would have to deliver all of her other babies by C-section because providers worried that the original scar could open up when women went into labor. We now know that this rarely happens, and many women can safely have a vaginal delivery after a C-section. But risk and success in regards to VBAC is very individualized. So first, why don't you tell me a little bit about your previous births? Do you remember what you had a C-section for last time? Oh, okay. Planned C-section for baby in breech position. Okay, so, and then baby number 2 was first baby, second baby was a vaginal delivery with no complications. That's great. And that's encouraging because we know that women who have had a prior vaginal birth and a prior C-section for fetal distress or malpresentation such as breech like you did, those moms are good candidates for TOLAC. And I see that your scar is along your lower abdomen, so you have not had a classical incision or an incision that is vertical across your abdomen. And then also, just to verify, have you ever had a previous uterine rupture? This is a spontaneous tearing of the uterus that sometimes can result in the fetus being expelled into the abdominal cavity. No? Okay. And how about any history of shoulder dystocia? This is where baby's shoulders get stuck. They may have had you get into different positions to help deliver the shoulders, or they may have put pressure down on your pubic area to kind of release the baby's shoulders. Do you remember anything like that with your vaginal delivery? No? Okay, great. And I see in your chart that your previous babies were 7 pounds 2 ounces and 7 pounds 6 ounces. Is that right? Okay, good. And then how about any surgeries on your uterus, such as a myomectomy? No? Okay, that's also good. The reasons why I ask these questions are because women with history of classical incision or with a previous uterine rupture, a myomectomy, or any other fundal surgery are usually not really good candidates for a TOLAC just because the risk is much greater for complications in those situations. So I'm glad to hear that you don't have any history of any of those things. And I see in your chart that your BMI is within normal range and your previous babies weren't large and you don't have gestational diabetes. And from what you've told me, you've never had a labor that has really halted. You've never had a shoulder dystocia, nor do you have any other clinical history that would indicate that you could not consider TOLAC as a birth option. So based on all of these components, I would say you are a good candidate for TOLAC if you would like to consider this birth option. If you did decide to go this route, I would recommend that you plan to go into labor on your own though, as TOLACs are usually not as successful with induction of labor, and I also would not want to put any more stress on your old incision area with any induction medications. And as always, I would like for you to have all of the information before you make your decision. So I want you to know that there are some risks associated with TOLAC, and also there are risks associated with major abdominal surgery like a repeat C-section. So risks for the trial of labor after cesarean are uterine rupture that we discussed before. That's a risk, and the incidence of uterine rupture is very low, but when it occurs, it is potentially life-threatening. And in the worst scenario, it would then potentially lead to possibly a hysterectomy or maternal or fetal complications or death. And that's in the worst case scenario in a very small percentage, and I'd be happy to get those numbers to you if you're curious what the actual rate of that happening is. And then Risk for repeat C-section is just similar to that of other surgical procedures. There is a potential of getting a fever, infection, blood clots in the legs, or needing a blood transfusion. So similar to other surgeries. And then, of course, there is risks that come for later on if you're planning more pregnancies, which it sounded like you were when you told me that before. So that's just something to consider as well, because then you've not had just one abdominal surgery, but two in the same area. On a personal practical level, a benefit of planned repeat C-section is that scheduled delivery allows you and your family the ability to make specific work-life plans. But so does induction of labor. However, like we discussed, TOLAC is more likely to be successful when labor is spontaneous, and that doesn't make it very predictable. So kind of a scheduling conflict, but to be expected with labor. On the other hand, benefits of having a vaginal birth after C-section are a shorter hospital stay, quicker return to normal activities as opposed to recovering from a big surgery. And generally speaking, pain is usually a little bit less with vaginal delivery versus a C-section. So as you can see, there are so many things to consider before choosing the method of delivery that is best for you and your family. It can be a little overwhelming to decide, so I'll send you home with some information regarding the risks and benefits of both, and you can think it over, discuss it with your partner. You have lots of time to think it over, and we can continue to keep discussing this at your prenatal appointments. You know, you have plenty of time. It's early in your pregnancy, and we can answer your questions as they arise. And if you think of any questions at home that you didn't think of here, once you get home, you can write them down and bring them to your appointments, and I'd be happy to address them. So what questions do you have right now?